Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health, and to my right is Dr. Bonnie Henry, BC's Provincial Health Officer. It's our COVID-19 briefing for today. I want to say how honored we are to be on the territory of the Lekwungen-speaking people, the Songhees, and the Esquimalt First Nations. And with that, I'd like to introduce Dr. Henry.
Thank you, and good afternoon. This is our update on COVID-19 here in British Columbia for the two periods of Saturday to Sunday and then yesterday through midday today. So between May 9th and 10th, we had 9 new cases who tested positive for COVID-19 here in British Columbia, and between yesterday and today, an additional 14 new people who've tested positive. So that brings our total to 23 new cases since we last reported on Saturday, and our total in the province is now at 2,353 people who have tested positive in British Columbia. That includes 873 people in the Vancouver Coastal Health Region, 1,118 in the Fraser Health Region, 125 people in the Vancouver Island Health Region, 180 people in the Interior Health Region, and 57 people in the Northern Health Region. We currently have 19 active outbreaks in long-term care, assisted living, or acute care, with an additional 8 cases in that area, bringing our total there to 291 residents who are affected and 184 staff. There are 19 long-term care facility outbreaks that have been declared over, and one of the units at Ridge Meadows has also resolved in the previous couple of days. We have no new community outbreaks, and on a very positive note, the outbreak that we had in a number of temporary foreign workers who were at the Bylands Nursery in West Kelowna have now all recovered, and there are no new cases, and that outbreak is officially declared over as of today. So that is excellent news. We know how much we depend on the temporary foreign workers who come into British Columbia to support our agriculture sector, and that their health and the health of our communities is paramount. And I want to really give a note of thanks to Interior Health, who spent a lot of time supporting this outbreak, and also to the community in West Kelowna, who stepped up to support the workers and the nursery through this very challenging time. Public health continues to provide support for the other community outbreaks that we are dealing with. And so in terms of case status, we have 634 active cases remaining in British Columbia right now, and of those, 66 people are in hospital, 18 of whom are in critical care or ICU. We've had 1 additional death to report in the last 2 days, bringing our total of people who have died from COVID-19 in BC to 130. And our hearts go out and our condolences to the families, the caregivers, and the communities of these people. We have 1,719 people who are now fully recovered from COVID-19. As everybody knows, to protect our province from this outbreak and to ensure that we didn't have rapid increase in cases in the province, we moved very quickly back in March, it seems a long time ago now, to put necessary orders and restrictions in place. And everybody in BC has been doing their part, and we are now in a much better place than we were a number of months ago. And as we look ahead to the restart of our province in the coming days, we want to move slowly and thoughtfully. Next week, if things continue to go the way that they have been going, and I fully expect they will, we'll be at the beginning of our phase 2 of our pandemic. But being patient and calm must be top of mind right now. Whether you as an individual, as a family unit, a business, you need to take the time you need to think about how you're going to adapt your activities to the new ways of operating in our province, to our new normal. I've heard from many who feel they'll be ready to go as soon as they're able to, and many others who want to take the time and look at their own individual circumstances. And that's okay. I think it is important for all of us to not feel rushed, to make sure that we're doing what's best for our families, our communities, our business. A steady stream will be far more successful than a rushing river that can damage things in its path. There are still new community cases that are unlinked that are arising every day, although they are smaller in number now, and that is also a very good thing. We also have a number of outbreaks that are continuing both in our long-term care, in some of our acute care facilities, and in the community. So this means COVID-19 has not gone away. It is still a risk to us in our communities, and we need to strike that right balance between the easing of restrictions to make sure that our forward approach is safe, practical, and sustainable in the long term. We do not want to have to go back, and the way that we have we're putting forward our restart plan is one that we hope will take us to that area, that sweet spot as we talk about, that will allow us to sustain this opening up over the coming months, regardless of what happens, that we're able to control the COVID-19 that we're seeing in our province. So when and if you reopen your business, do what is right for your business to protect yourself, your employees, and your customers. And be patient. That's my word for the day, patience. We urge everyone to show that kindness to your favorite store or to your favorite salon owner as they adapt their business and meet the new rules we have in place. Some businesses will take longer to open or may not open for many months because they feel it's not safe for them to do so. And we need to, all of us, be aware of our own unique circumstances that make it more or less risky for us to take this next step. And that's okay. Nobody should feel pressured. A thoughtful and measured approach will keep us all safe. We can, however, safely restart our province with everyone doing what we've been doing and working together. We must encourage and support each other with patience and with care. And we also must remember all of the important things that we still, all of us, need to do. That's including keeping that safe distance between us everywhere, whether we're outside, whether we're in a store, in a business, in our office. We also need to wash our hands regularly, cover our mouth when we cough, and very importantly, of course, is to stay away from others if we're feeling at all sick during this important transition time. And we must all, of course, continue to be calm, to be kind, and to be safe.
Thank you very much, Dr. Henry, and I wanted to join you in passing on my condolences, that of the Premier and the government, and I think to all people in BC, to the individual living in Fraser Health and their family who passed away this weekend from COVID-19. I think it's continuing to be difficult in these times, and I had some experience of this weekend in talking to many people who have family members in long-term care, but how difficult these times are for people who are struggling, who are living in long-term care or are in an acute care setting and who can't get the visits and the engagement with family members. But this is particularly true of those families who've had someone pass away from COVID-19, 130 of them now, one over the weekend, and we pass on our condolences as they grieve and as we grieve with them. I note that we had 23 more cases over 2 days this weekend. In our acute care hospitals, we now have 66 cases. That's 38 in Fraser Health, 2 in Interior Health, 1 on Vancouver Island, 3 in Northern Health, and 22 in Vancouver Coastal Health. And only 18 of those now, or 18 of them, are in critical care. We have 3,933 acute care beds that are available. They're essentially empty right now. That's 64.8%. That number, the occupancy rate, is coming up across the province as other activities take place, and we expect it to continue to do so. We have critical care beds, some of which we've added in this time. Occupancy is 46.3%. To give you a sense of what's happening in the community, there is fewer calls to the ambulance service for influenza-like conditions. On April 30th, that number of calls was 227. On May the 7th, it was 169. So we're seeing those calls coming down as we come, of course, to the very end of flu season, but also reflect, I think, what we're seeing in other numbers. I wanted to just briefly speak to the people working in long-term care and to the families and caregivers of people in long-term care. We know how hard and difficult these times are, and I want you to know that we're with you. We're thinking about your concerns. We are thinking about how it might be that we can bring families together more. But there are multiple outbreaks in long-term care, and if we view the situation in other provinces and in other countries, we know how vulnerable people in long-term care are from COVID-19. The number of people who've passed away in British Columbia is high. I believe the number is 82. The number of people who've passed away in other jurisdictions in the thousands in Canada tells us how significant the situation is, how much I think it challenges those working in long-term care to maintain a sense of, as Dr. Henry has said, patience and calm and serenity and support under these very difficult circumstances. And I want to pay tribute to all of them, to the family caregivers who even through other means, through FaceTime and other means, are supporting their family members in these times, and all the people who are working in long-term care whose work should be a source of pride and is a source of pride to people across British Columbia. I wanted to say, when you look at where we are today, it's tempting to think that we've made some advances against COVID-19, but it is still here. As Dr. Henry, as Dr. Tam have made clear, and as public health leaders around the globe have said, we can't let up. In BC, COVID-19 is not on the run. It's still here. It's still here in every health authority, looking for chances to take a greater hold again. And we can't give it that chance. The risks are just too high. Rebooting this virus now, or a second wave later in the year, will put all our surgical, social, and economic renewal plans at risk. This coming long weekend, we know, is the kickoff to summer for many people. If we continue to use the knowledge that Dr. Henry has given us, adhere to physical distancing, regular hand washing, avoiding gatherings, and no travel unless it's essential, it will be another long weekend where we help stop the spread. The best way to make the May long weekend a good one for us is to ensure that we continue to gain strength in our work against COVID-19. We are still right now in phase one. We still, all of us, have to act like it as we work and adjust and prepare for possible changes. Until Dr. Henry tells us otherwise, that means stay local, stay apart, stay safe. Let's stick with what works for BC. Let's follow the rules, not the urge to bend them. The best place to be in BC is where you live. Let's make that the cornerstone of a spectacular BC long weekend coming ahead. Stay local, stay apart, stay safe. Let's stay 100% committed to our fight in BC, for the ones we love and for the ones we haven't met. Aujourd'hui, nous faisons le point sur le nombre de nouveaux cas pour deux périodes de référence de 24 heures chacune, soit celle de 9 à 10 mai et celle de 10 mai jusqu'au 11 mai en mi-journée. Nous sommes attristés d'annoncer un nouveau décès lié au COVID-19 dans le région de santé de Fraser, pour un total de 130 décès en Colombie-Britannique. Nous offrons nos condoléances à tous ceux qui ont perdu leurs proches. Pour la première fois de référence qui s'étend, période de référence qui s'étend jusqu'au 10 mai, nous avons eu 9 nouveaux cas. Au cours des dernières 24 heures, 14 nouveaux cas se sont ajoutés. Cela représente 23 nouveaux cas depuis notre dernière mise à jour samedi, pour un total de 2353 cas en Colombie-Britannique. Parmi l'ensemble de cas confirmés de COVID-19, 66 personnes sont actuellement hospitalisées, dont 18 en soins intensifs. Les autres personnes dont le test de dépistage a été positif sont en isolement à leur domicile. Thank you very much, and we're happy to take your questions.
Thank you. As a reminder to everybody on the phone, please press star 1 to enter the queue. You are limited to one question. I would also ask that you please unmute your phones. You will not be audible until I call your name. First question is from Tanya Fletcher, CBC.
Hi there, Dr. Henry. looking back at the weekend, do you feel that people are ignoring the physical distancing guidelines? I'm sure you've heard by now there's some outrage over just how crowded the parks and beaches were, with people expanding their bubbles, perhaps some of them before the May long weekend. So is there a chance we'll have to go back to stricter rules? And also, Minister Dix, we have a request if you could answer this question in French too, please. Thank you.
Sure. You know what? I had the pleasure of getting outside a few times myself this weekend, and I did see lots of people. But you know what? The vast majority of them were in small groups. They were sitting apart from each other. They were socializing. They were out in the sun. You know, I think the vast majority of people are doing the right thing and taking this to heart, and I thank them, because that's how we're going to get through this. And I know everybody, I mean, it was such a spectacular weekend. There was a lot of pressure to just be done with it, but people were reasonable and they were responding. And I think we can sometimes get caught up with the small minority of people who are maybe having too much fun and are disturbing those of us who were trying to keep a little bit separate. But the vast majority of people were doing the right thing, and I think that's what we need to do for the coming days and months, to be able to go outside, to be social with each other, but to maintain those physical distances and to be respectful of others around us as well. I think that's incredibly important.
Just to say in English, I was out a reasonable amount this weekend outside, and what I would say, at least in my neighborhood, which is in Joyce Collingwood in Vancouver, that there was a significant, I think, effort by everybody to follow the rules. In fact, everywhere, whether it was at Gaston Park or Melbourne Park or Collingwood Park, people were doing just that. They were outside, they were following the rules, they were staying apart, and they were enjoying in this case, a beautiful Vancouver weekend. Je veux dire en français que je pense que la grande majorité des gens, ce dernier week-end, ont suivi les règlements, ont suivi ce qu'il fallait faire pendant cette période, la première période de notre bataille contre le COVID-19. Il y avait bien entendu des gens qui ont fait autrement, mais comme on a vu au mois de mars, où il y avait un débat pareil, je pense que des gens, la grande majorité des gens ont agi de la bonne façon, et le résultat, c'est le résultat qu'on peut résumer des chirurgies. C'est à cause des gens qui ont suivi les règlements. Le fait qu'on peut recommencer des entreprises de plusieurs types, c'est à cause du fait que les gens ont suivi des règlements. Et il faut continuer à faire cela dans les jours et même des mois et même peut-être des ans à venir pour qu'on puisse célébrer en Colombie-Britannique ensemble, sans se mettre, nous mettre en danger. Et donc, on doit continuer. C'est un travail à suivre et c'est un travail quotidien. Il y aura des journées où cela va être difficile, mais je pense en général, les gens ont bien fait.
Next question is from Mary Griffin, Check News.
Oh, hello. Thank you so much for taking my call. Dr. Henry, I just wanted to ask you, my understanding is on Vancouver Island, there have been few outbreaks of COVID-19 in long-term care facilities, and I'm just wondering, why was it different? We have many facilities here on the island, but was there any action taken that prevented it from being worse here? Thank you.
Yeah, that's a really good question, and I think, yes, we were alerted early by the first outbreaks we had. Unfortunately, the larger outbreaks in Lynn Valley and then Harrow Park, which occurred very close to each other early on in this, and that we learned from that across the province. So we took measures to try and put preventive measures in place across the province in all of our long-term care homes to do the best that we could to prevent introduction into those those areas. So yes, it's been very successful here on the island. There's been a number of cases in interior health, but the north as well has been quite successful at prevention. And part of that was learning as we went from our pandemic. And we can see that as well. The Lower Mainland has had the most cases of people who've been infected. There was the most transmission, the earliest onset of cases in those communities. So we learned from what happened there. We can also see that as we've progressed through this pandemic, those measures and the approaches to managing outbreaks in long-term care have meant that almost all of the more recent ones have been very small numbers, and that these measures have been effective at preventing that widespread transmission that we're seeing, that we saw early on, but also that we're seeing in other parts of this country and in other countries as well. So, it's timing and learning, and I think that's probably what we have tried to do with everything as we've experienced this pandemic, is look at what's happened around the world, look at what's happening in our own province, and learning from that as best we can. And it's been relatively successful.
Next question is from Richard Zussman, Global News.
Dr. Henry, I asked about smaller gyms last week, just an extension of that. When should we expect dance studios and gymnastics classes to be restarted? And is there a way, I've heard some concern from small gym owners, is there a way for the health authorities to speed up inspections of the smaller facilities, like was done at something like the Burnaby Winter Club, to get those places up and running before phase 3? So dance studios, gymnastics classes, and some of those smaller fitness facilities.
Yeah, so the short answer is, the process is going to take time, and even those smaller facilities need to have an appropriate plan in place, and they need to really look at the business model that they have and their ability to keep people separated in time and space, so that we're not having groups of people in there together. And so that will mean changes. And some of this, I know there have been many smaller gyms that have adapted by doing combinations of virtual and outside classes and small in-person groups. So those are things that everybody's going to have to look at. And when they feel they're ready, then we know there's a process for public reporting. I will say, however, that for gyms, these are all facilities that we have seen transmission of this virus in some parts of this province. So there are local MHO orders in Island Health, Interior Health, and Fraser Health because of transmission that has occurred in those facilities. So that will be up to the local MHO when they feel it is appropriate to lift those orders. And I know that right now most of them are going till the end of May. So that gives people time to come up with their appropriate approach.
Next question is from Andrea Wu, Globe and Mail.
Hi, Dr. Henry. I was looking for some clarity on what the provincial guidance is on isolating residents of long-term care facilities, both when residents have symptoms but haven't yet tested positive for COVID-19, and also after they have been confirmed positive. So, for example, are they restricted to rooms by themselves? Are they restricted to shared rooms with others? And are there any changes within a facility to the staffing of healthcare workers who tend to them?
Yeah, so there's no short answer to that, unfortunately, and it depends on the facility, and it depends on the type of rooms that are available in those facilities. So when there's an outbreak, anybody who is positive, as much as possible, they try and put them in a single room by themselves, or anybody with symptoms, but that's not always possible, depending on how the facility is arranged. So there is attempts to try and ensure that people are isolated, whether that means that they stay in their room and they don't have any contact with others, or whether somebody might be moved out who's a contact. There are different things depending on the situation. But I do think we have to remember that, in long-term care, these are those people's homes. And so there's a comfort level, and there's an important part of being in your own space that can tip people off if they're moved to another place, particularly people who have early onset dementia or have some cognitive disabilities. Moving them can be very traumatic and difficult. So each facility has a way of looking at that. As much as possible, we try and remove somebody from a room if they are sharing with somebody who has not been exposed while they're being examined, but that's not always possible. And in terms of staffing, again, it depends. We know that when we don't have the communal dining, for example, and people have to have their meals in their rooms, that means you need more people to assist people, because they now have to do individual meals for people, and many residents need assistance with individual meals. So it does make a change and a difference, and that's where it is so important for our support workers in long-term care, as well as all of the staff, to try and come up with a plan that best supports the residents depending on the situation. And I know particularly in the Lower Mainland, where Fraser Health and Vancouver Coastal Health have an approach that's we call it a SWAT team approach, where they're able to put extra resources into the facilities that have outbreaks to try and support those important measures that allow the residents to get the care they need in a safe way.
Next question is from Marcella Bernardo, News 1130.
Dr. Henry, thank you for taking my question. You keep saying that you and Health Minister Dix both keep saying that most people are behaving, and while most people are behaving, most people don't drink and drive. So there are consequences for those who do drink and drive. So if people are constantly violating these rules, which we have witnessed over the weekend, what are the consequences for them doing this?
Yeah, so, we have taken the approach from the very beginning that if we provide people with the direction of what they need to do, the support they need to do it, that the vast majority of people do what is needed. And that's the approach we've taken. We do have bylaw officers, and we have others who are able to provide individual advice and warnings to people, but we are not taking a punitive approach in this province, and that's worked for us. And it will continue to work for us. I think most people recognize that if they're doing things that are going to increase the risk of spreading this virus, that it is their loved ones, their families, their communities, the people they live with, that they're going to take it home to. So that is the underlying approach that we're taking, and I think it's worked for us, and we will continue to do that. And we've seen police officers, bylaw officers out and taking that positive approach and thanking people who are doing the right thing. And that's the way that we need to keep approaching this going forward.
Next question is from Hina Alam, Canadian Press.
Hi, Dr. Henry. I was wondering if you could tell me a little bit about this. I saw a study that was published today from a Harvard author, and it said that one of the reasons why the 1918 flu pandemic was so widespread was because the lockdown was for less than 12 weeks. And we've seen this in South Korea, and we've seen this in Germany, where COVID cases are coming back. So I was wondering if you're afraid that if we lift our lockdown too early, before 12 weeks, that seems to be the magic number, that we might go back, the cases might spike and we might go back to square one.
Yeah, obviously these are things that we've been watching very carefully. And I will say this is not influenza. So some of the parameters around influenza we cannot use in managing this virus. And so we are learning as we go. And absolutely, we're watching Germany, where, again, they have an approach that's very similar to the approach that we're taking. And there has been a slight increase. It's a little bit hard to know exactly why in Germany, but we're watching that very carefully. We're looking at a number of other countries like New Zealand, Norway. Some of the Scandinavian countries have also taken very similar measures, and we're watching what's happening, of course, across North America, but particularly in Quebec and Ontario, in Saskatchewan and other places where they're making similar changes like we are. I will say that in Korea, exactly, I've been watching that very carefully, and one of the areas that they had not shut down were nightclubs, and a huge part of the recent surge has been because of exposure events in a number of nightclubs that have exposed several thousand people, that they're now seeing transmission. So, if you look at our plans, what we've put in them is what we believe, based on evidence that we've seen around the world, are ways that we can sustainably open up our economy, our social connections, without tipping over into that place where we might get rapid increase in cases again. So we'll be watching that very carefully, as they have been doing in Germany and Korea and other places. And I'm confident, if we all do our part, that we can do this in a safe way. But then I go back to what we've talking about. It needs to be thoughtful and measured, and we need to look at our own circumstances. And those large gatherings, particularly where we get together and socialize indoors, those are the riskier settings, and those are not in our foreseeable future for the next couple of weeks or months.
Next question is from Jeff Andreas, Radio NL.
With the border set to, I guess, potentially reopen as of 21st, so 10 days from now, just wondering, I guess, what the concerns are if that were to happen, and sort of what the talks are that the provinces had with the federal government. Just, I assume you're still wanting to convince them to keep borders closed at this point in time. Is that the message that's being delivered right now?
Yeah, so I'll let Minister Dix talk to this as well, but absolutely, we have concerns about opening the borders. I do think we have some leeway, and we need to look at family reunification, for example. I know it has been very hard on some families who have members on either side of the border, but broad reopening of the borders is not in our best interests in the coming weeks. Obviously, we want to make sure that we have our essential goods traveling back and forth, and we are all dependent on that. But we need to have the measures in place to protect our communities here as well.
Just to say that the Premier has repeatedly made this point to the Prime Minister. It's our view that the border should not open for visitors at this time, and that regardless of that as well, remember that people who return, Canadians who return to Canada in these circumstances, must self-isolate for 2 weeks, and we in BC, uniquely really in Canada, have ensured that happens. We have people right now in quarantine in hotels in order to satisfy this condition in British Columbia, and we're going to continue to ensure that. So there's always talk about what would happen with opening the border and its effect on certain industries, but that is not likely to change given the situation in other jurisdictions. It's different in our own country, where we know and we're working collaboratively with other provinces and the federal government, but with respect to the United States right now, it would make no sense to have visitors traveling either from Canada to the United States and returning, or to have visitors, not essential traffic, but visitors coming from the United States to Canada. And I'll be making that very clear. There's a health minister's call immediately after this session here, and I'll be making that clear once again to the federal health minister, who I think well understands our position.
Next question is from Shannon Waters, BC Today.
Hi, I think this will be a question for both of you. I'm looking for a little more clarity around the province's PPE situation, and specifically how that's going to play out with reopening efforts. We're still hearing from frontline healthcare workers that they don't have, what would typically be considered adequate protection for treating COVID-19 patients, and now we're talking about reopening some businesses and relaxing social restrictions, which will likely cause at least some increase in the number of cases that we're seeing, as well as some of those businesses may be looking to get their hands on PPE, as well as rescheduling surgeries, which will also place a demand on PPE. So I'm wondering, what's being done to manage the PPE supply and what the province foresees in terms of demand as we start reopening.
Yeah, so I'll turn to Minister Dix in a minute, but I think one of the things that we need to be very clear about is what is appropriate PPE for each situation, and we have been doing quite a lot of work on that around in the hospital, and what do you wear in different sessions, what do you need when you're caring for somebody with COVID-19, what do you need when you're caring for others in that setting right now, in long-term care and all of our health care settings. And we are having ongoing discussions with our community healthcare professions, including physiotherapy and OT and physicians and dentists in the community. So those guidance are coming around what is appropriate PPE in those situations. When we're talking about businesses, we're not talking about the same level of, the same type of personal protective equipment, because what is needed in the healthcare sector, so medical masks and medical respirators, things like that, are different than what we need in the community when we can, for the most part, maintain our physical distances. So we're basing our responses on the layers that we need to protect people. So we can either have we can decrease our numbers of contacts, or we can increase our safe contacts. And what we need to look at in the businesses that are opening and in our social connections is, how do we have safe contacts? And that may mean keeping our distance. It may mean the use of barriers in different areas, reducing the number of people in a store, for example, having those models where you have a hybrid of online versus in-store shopping, and in some cases where you can't consistently maintain that distance, the wearing of non-medical masks in the community. So those are all details that will become clearer as we work our way together through this next few weeks.
I've been updating, I think, every Tuesday on the number of on PPE that's come into the province in that previous week, and I'll be doing that tomorrow. But as noted, we've obtained 3.5 million, for example, N95 masks, respirators in the province since the beginning of April, and we haven't deployed those yet because we're going through a very systematic effort to ensure that they meet our standards, and as well that we work with healthcare workers to make sure that the fit is right, and that we work with them on a product that, for example, one that doesn't say 3M on it because it's not from 3M, who's our main and traditional supplier. We've also maintained supplies from some of our traditional suppliers as well in smaller numbers. Obviously, the international market has been profoundly disrupted, but we've been successful, I think, in obtaining very significant quantities of PPE, which I'll be again reporting on tomorrow. I would say this, though, that work is going to continue in the days and the weeks and the months ahead, because COVID-19 is, there is no vaccine, as we've said many times, there is no cure. And we have to prepare not just for now, not just for the immediate, not just for the relaunching of surgeries, which you're quite right, requires sufficient supplies of PPE, but in the weeks and months and so on to come, which means, I think, in Canada, ensuring that we have better domestic supply of PPE, given the disruption to the international market that has taken place and will continue to take place. And we have to continue to do the work so we not only have supplies now, but supplies in September and October and November, and have developed a very large stockpile to meet even an increase in the utilization, the likes of which we've seen in recent months. So that's the situation right now, and I'll have more for you tomorrow.
Next question is from Nelson Bennett, Business in Vancouver.
Yeah, just a clarification. So last week, I wasn't quite clear whether fitness centers fit in the phase 2 reopening. The Joint Information Center informed me that yes, fitness centers, yoga studios, etc., were part of recreation and sports, and therefore part of the phase 2 reopening. A reader emailed me to say no, WorkSafe BC says they're not allowed to reopen as part of phase 2. So can I get some clarification on that? Can you go to
it kind of depends. So yes, they can reopen in phase 2 if they meet certain criteria. And part of that criteria reflects the fact that there are local orders in place that close gyms and those types of fitness facilities in 3 parts of the province. So they have to meet those requirements, and they may that may take people until the end of May or June for many places. So it is a phased-in approach. It's not always that easy to figure out. But once people who own gyms and fitness centers can start their process, and they should be doing that already to meet the requirements, and those who can look at starting to open starting on after this the coming long weekend.
Next is Emily Lazatin, CKNW.
Hi, Dr. Henry, your minister. I wanted to ask about families who are looking to get their parents or elders who are currently in separate care homes into one care home. I'd imagine that this is on hold, but if there are facilities with no current outbreaks, can this happen? And if that's not the case, at what point can it happen?
A very good question. Right now, facilities are taking the approach of accepting people in from the community or from hospital, depending on whether they're in an outbreak or not. So that would fit, as far as I'm aware, into that whole process. I can't speak specifically to reuniting of family members from one care home to another, but I know that there are processes in place for all facilities who aren't in an outbreak situation to be able to accept people in to that facility.
Next question is from Keith Baldry, Global News.
Hi, good afternoon. Thank you very much for this. Dr. Henry, I know you've been saying you think the vast majority of people are buying into the social distancing rule. The Vancouver Parks Board today released figures showing that so far more than 11,000 groups of people have been issued warnings, and this past weekend almost 2,000 groups were issued warnings. So if you do the math in terms of groups, we're probably talking several thousand people in a small area were issued warnings. Is that, as we go into the summer, this is the first long weekend, or the first really hot weekend, of which we're going to have many. Is there a concern that this type of behavior can't really be policed in any effective way?
Well, I think that's a good measure of how well it is being policed. And, you know, when people get the warning, they get the education, the advice they need to do the right thing. And what I hear from those people who are issuing the warnings is that people are being respectful and that they are taking it to heart. So, I can only tell you again, we all need to do our bit. Being outside is safer than being inside. But even then, we need to take those measures to protect our families, our groups, our communities. And I encourage everybody to continue to do that in a respectful way, and to do that respectful and mindful of others who are around you as well.
So we have time for one more question this afternoon. For any reporters that didn't get to ask a question, there will be a statement released later this afternoon. For recommendations on protecting families and communities from COVID-19, visit bccdc.ca. For non-medical questions about the province's COVID-19 response, visit gov.bc.ca/COVID-19. And for a full listing of the Provincial Health Officer's orders, visit gov.bc.ca/PHO guidance. Last question is from Jane Side, North Shore News.
Hi, Dr. Henry. I am curious to know how our understanding of the virus has changed, and how that is changing the things that you are recommending. Early on, there was talk that maybe wearing a non-medical mask or non-surgical masks wasn't recommended because people were going to be touching their faces, and now we're sort of hearing that maybe it might be a good idea in some circumstances. And I guess I'm curious to know sort of how that new information about the virus is changing the recommendations in BC.
Yeah, I think that's a very good example. We do, and it still remains a concern. There's evidence that shows that if you wear a mask, it can be irritating, and it means that people sometimes will be more likely to touch their face and nose. So what has changed has been our understanding of when people shed the virus and therefore can be infectious to others. And what we've seen around the world, that there are some people who may not recognize that they are sick or have very early symptoms, or be in the day or two before their symptoms noticeably start, and they can have high viral loads, we call it. So they can have infection in their secretions, virus in their secretions that can infect others. So that is new. That has changed. When we look at SARS, the first SARS outbreak that we had in 2003, when we measured people's viral loads in their secretions over time, it built up over a period of days. So your symptoms started, and then you had your peak viral load around day 5. And we had a very long incubation period, like this one, which is around 2 weeks. When we look at this SARS virus, so SARS-CoV-2, the virus that causes COVID-19, we see a different profile. Even though it's a longer incubation period, what we're seeing is that people can have lots of virus in their secretions early on. So in day 1, day 2, and sometimes even before they have symptoms. It's a little bit different than influenza. So influenza, we know that people shed virus before they have symptoms, but it's a very short incubation period. So people get sick and they pass it on to each other, and they can be sick within 2 to 3 days. So different situation than influenza, but it has led us to think that it is important when those times when we cannot maintain that physical distance consistently, so places like some retail outlets, if they don't have plexiglass barriers, which are very effective at keeping our droplets away from each other, that short-term wearing of a mask may prevent transmission in those situations. But it's not about protecting me. If I am wearing a mask, and we've said this all along, it's about keeping my droplets in. So that is the situations where we might wear a mask if we are either sick and having to go out to get medical care, or in those situations where we might be in close contact with others. And we're now thinking, and this thinking has changed because of the way that we've learned about transmission of this virus, that's probably a good thing for us to do. But we still need to be careful, because it doesn't mean you can't, you can get closer to people, because we know that the distance is really important. It doesn't mean you can stop washing your hands and covering your mouth. It doesn't mean you can stop not touching your face. And we have to be very careful, if we're wearing a non-medical mask, that we wear it over our nose and mouth, or else it doesn't keep all our droplets in, and then it doesn't work either. And that we don't fiddle with it and touch it and then rub our eyes, because that's another way we can self-inoculate. So where it works best in those short-term situations, so we don't want people wearing it all day long, for example. Much more important for us to keep those physical distances. But if we are taking the bus, for example, then it works best if we are both wearing one, because that reduces my chances of coughing on you and your chances of your droplets getting out into the air or the surroundings around me as well. So that's been our change in thinking around non-medical masks, and it is, we try to learn and adapt as we've been going along with this.
That's all the time we have today.
Much.
Thank you.